infertility.
Tell us.
Now, there are many types, many causes of infertility. But I want us to go to the woman's side, one of the causes of infertile. Then, when I finish, I also go to the men's side and note what some of the causes of infertility in the men. Because always we blame the woman. Now, one of the disease is called fibroid. Fibroid. What is fibroid? Fibroids are loose, or they are tumors that grows inside the womb or outside the womb. When a woman reaches her puberty, the ovaries produce more hormones, especially estrogen and progesterone. High level of these hormones may help tumors to grow. So when a lady began to reach a time of puberty, since the hormones, the ovaries produce a lot of hormones, and the estrogens and progesterones, higher level of this may let tumors grow. So when you say something is fibroid, fibroids are tumors, or they are loose that grows inside the womb of a lady. About 80% of women are having fibroid. 80. Listen well. But about 40% of them does not know that they are having fibroid. Because since their whole lifetime, they can give birth to any amount of children they want. It will not disturb them. It does not do anything. But this 40% of women may have this fibroid. Now, when this fibroid is being formed, at times your doctor may say that they are small, they are not matured. So when they are not immature, they can diagnose you of having myoma, cheese. You see that you're having cheese, myoma. But when it's being matured to a certain stage, they will diagnose you having fibroma or fibroid. Now, what causes this to grow? Or what causes this fibroid to germinate or to grow? First of all, is hereditary. When a woman is having a fibroid, when you give birth, your female child, once she also grows, she may also have it. Then, painful menstruation. When a lady reaches her puberty and she's been having her menses, then everybody hears her. He began to struggle a lot when he reached that week. Everybody hears that the matters has started. She began to suffer a lot. Well, the pain means that at times there is a tumor which has been started and it has blocked the production of the blood to flow. That makes that pain. So when you don't solve it earlier, this can cause fibroid or infertility of that child. Amen. Then another cause of fibroid is poor dietary choices. People does not take in more fruits. People does not like taking fruits. At times eating that salmon frecula, that food. When you take that frecula, the frecula is 80% carbohydrate. It does not do anything for the body. So let us reduce intake that frecula. We have something called, we call it in Ghana, we call it shri. I don't know that the English name for shri. Shri. That's why like chalk. What as a woman, you take in more this product, shri. It can't digest. It blocks the tubes. It can block the fallopian tubes. It can harm you a lot. And at times, one of the causes is sexual intercourse during menstruation. When a woman reaches that week, as a man, give her a chance. Because She used to pass through only 7 days, maximum 7 days. As a man, give her a chance. When the person is having menses and at the same time playing, the blood which was supposed to come will block. When it blocks, it will begin to form as a tumor and can lead to fibroid. And environmental factors. Those who are doing cleaning jobs. When you are doing the cleaning jobs, you must cover your nose with a mask. The chemicals that you inhaled into the body can also cause you infertile or fibroid. Another cause is weakened immune system. Some of the ladies' immune system are weak. And so when your immune system are weak, it can also be a cause of it. Then complications of family planning drugs. Family planning is one of the deadly cause of fibroid. Family planning does not help a lot at all. As a lady, God has given us the natural way of having family planning. We have a lot of family planning. Family planning, we have a lot. The natural source, we have a lot. The natural way of having planning, a lot. That you may know. When you take these medications, it can help you have fibroid. Family planning can give you hypertension. Family planning can give you diabetes. The side effect of the medicine or the complication of the medicine can let you have diabetes. Can let you have a lot of women were not having diabetes or hypertension, but as soon as they started with family planning, they had diabetes. Because when you take family planning, sometimes 3 months you may not be menstruating. Sometimes 6 months. As soon as you take in the family planning medication, you see that you have menstrual disorder. When it comes this month, the 3 months will not come. 3 months will come only once. At times will come only 1 day. Black. You see that it's something like quota. Black. It's due to the family planning medications. Then that emergency contraception. You saw that the match that you played, it will lead to something. So after having the sex between more than not less than 72 hours, you took emergency contraception medication, and it can cause you fibroid. Amen. Amen. Now we have types of fibroid. We have something called intramural fibroid. We have some which is inside the uterus. This one is inside the uterus. It's called pediculated fibroid. We have something called intramural fibroid, which is behind the uterus. We have submucosal fibroid. We have subcerebral fibroid. We have different types of fibroid. But when we are having these types of fibroid, at times when we go to hospital, the doctor will say that it is not matured. We can't operate it. We can't do any surgery. They will tell you, go and come next month, 3 months time, 6 months time, before it will be matured and they will be able to operate it. And when they operate it, the doctor can have only the chance to operate these two, only these two. These are the matured ones. The small ones, the doctor will leave it. When he attempts to take in the small ones, then you have to remove all the uterus away. So they will leave it. So as soon as you do fibroid operation, about 6 months time, 1 year time, the next one will germinate again. So if you do 3 times, 5 times, it will still come. Why? These are some of the fibroid. It has covered all the uterus. All the uterus. These two pictures are the normal uterus. This one is the normal uterus of every female. The normal uterus, you see that the body is being clear. But when the person having this fibroid tumor, this is how the stomach look at. At times you may see that the person is even getting 4 days to get 4 days time and the person will conceive. Why is no this time? This pregnancy has kept long. Has your time not reached? Also, this is not pregnant too, it's fibroid. At times you see that the person is pregnant, but it's not pregnant. So this production will let it, the belly become very big. So when the person being operated, this is how the fiber looks. After the surgery, this is how it looks. Now, we have seen the types of it. What are the signs and symptoms? When someone is having fibroid, what are the signs and symptoms? One, the person will have severe bleeding. Severe bleeding. The person will bleed a lot. The person can bleed more than 7 days. A person can bleed this month. Within 2 weeks time, the person can still bleed again. It's also a sign. And heavy or long menstruation period. The person can also have irregular menses. This month it will come. 3 months time it will come again. But it's supposed to come every month. And at times you see that it will come only 1 day. The next day you will not see anything. 3 days time it will appear. And also the person will have pressure of the abdomen. And at times you see that something is moving around to the stomach. Going to your left, it will come to the right side. There are something will pinch you as a needle. These are all signs. And at times you see that inside your cord, you see that you have pain inside. And once someone is having fibroid, and the person will reach at its mature stage, the person will not have feelings for any intercourse. At times the person will not have desire even to see her man. And also when it comes at this time, you see that the person will not have you have much pain during intercourse. And you see that at time when a man falls, you see that there will be a presence of blood. Blood will be coming. And once somebody is having this fibroid, one of the symptoms is miscarriages. Miscarriages. Because this is where the child is supposed to be. When you get pregnant, this is where the child is supposed to be. And the fibroid is also already there. So when the child enters, it will bring it out. Let it will come out. So that is the cause of the miscarriages. It's also one of the causes. Now, it's not only fibroid that can cause infertility. At times, when the fallopian tubes are blocked, when one is blocked, one can work. But when the two are blocked, the person does not have any chance of having pregnancy. And also, sometimes it is ignorance. Somebody may come to my place. I'll examine the person and know that the person is having no problem. By the time that is due for pregnancy, they does not meet at that time. Ignorance. You must know your dates. It's not all the days that when you see your man you can get pregnant. Sometimes one may have only 1 day. And at time, when the time is due, you'll be having quarrel with your husband. And when the time is due, you can go to him. Some may have 2 days, 3 days, maximum is 1 week. So, because of time that I'm rushing, when you know your time, that this is a time that I may conceive, you may conceive. And even if you want to give birth to a male child or female child, I can teach you to know that this time. Amen. Because somebody has given birth to 3 females, 2 females. You didn't do it at the right time. I will educate you and know that when you do it at this time, it's for me. At this time, you may conceive a male or female. Now, apart from fibroid and block in fallopian tubes and other things,